you all so much for joining this afternoon. I'm really excited about this panel at Climate Week to feature the climate and the mental health impacts of climate change on one of the most vulnerable populations, which is young people. I want to start off with thanking our co-hosts, the American Public Health Association and the Climate Mental Health Network for doing so much to pull this panel together. And a big thank you to our physical host for this space, the Church of Jesus Christ of Latter-day Saints. Really incredible to find this kind of space for Climate Week for this critical subject around youth and children mental health. So I'm going to be handing off to our moderator for this event. Another thank you for this event, Nina Dietz. So Nina is a freelance journalist covering climate change, the environment, and both human and planetary health. She has written a great deal on the intersection of climate change and mental health, and you can find her work at Inside Climate News as well as many other publications. Thank you, Nina.
Thank you, Ben. So we're going to start off with a bit of framing from our youth panelists, talking about sort of how the climate crisis has impacted their mental health. And Sarah Newman, who is the director, the executive director, I'm sorry, of the Climate Mental Health Network, will be leading this part of the panel. Sarah founded the Climate Mental Health Network in 2021 after her own struggles with climate emotions. It is now a national organization that leads research and offers programs and resources for youth, K-12 educators, and parents across the United States. And just before we dive in, our youth panelists are Elisa Teles Munoz. Elisa is a climate education leader, youth mentor, and project manager. She is the K-12 program leader at the Climate Mental Health Network, helping to develop and implement climate education and engagement resources to educators. Allison Sue. Allison is a senior at Barnard College, studying environment and sustainability and psychology. She conducts research on urban climate resilience planning. Her thesis is focused on addressing youth inclusion in the planning process. And Natalie Heller. Natalie is on the Gen Z board of the Climate Mental Health Network. She studies public health and environment studies at George Washington University. She started her climate work with a local youth grassroots organization and is currently focused on climate and mental health.
Hi, everyone. It's great to be here. I'm just going to give 1 minute remarks because I want to give all the time to the Gen Zers, but I just wanted to say that the Climate Mental Health Network, we have a very strong youth focus in our work. I am clearly not a Gen Zer. I am Gen X. But one thing that I realized is that from the time that I've been in high school, so forth, I have been experiencing a lot of this eco-anxiety that young people are experiencing at such high rates now. I just never had the language to describe what I was going through. And our work is very youth focused. And I would also say that, I know it might sound cliche, but I truly am driven and inspired and informed and guided in my work by the young people on our Gen Z advisory board, by the young people that are working in the organization. Their vision, their experiences, and their voices are essential to what we're doing as an organization. And we have an intergenerational strategy that's working also with K-12 educators and parents, but it's really something that guides and grounds me in my work. And so Elisa is someone who's Gen Z. She's leading our K-12 programming. Allison is a student at my alma mater, Barnard, which I'm very proud of, who I connected with online, and she's doing incredible, incredible work for her thesis. And Natalie is part of our Gen Z advisory board and has done incredible work in the Bay Area as a youth climate leader. And so I'm going to turn it over to each of them to be able to speak about their experiences with climate emotions and what they're doing for their self-care practices and so forth.
Thank you, Sarah. Hi, everybody. My name is Elisa. So when I always like to preface any conversation I have about climate with the fact that when I was in high school, I grew up in Connecticut, and the issue of our time and era was gun control. And so that was really, really important to me. I graduated in 2018, which is the year that the shooting happened in Broward County in Florida. And so I organized our school's walkout. And issues of the environment felt very removed. I really didn't understand the connection between climate change and people and the more than human world and how that affected me. And so I had this real nasty chip on my shoulder about it. And I would tell everybody that I didn't care and that it just didn't affect me. And I really didn't understand the problem. And then when I went to college, at American University, I took a course on environmental ethics, just because there was a seat available in the class. And it changed my life. It changed the course of my career. It was the same year that the 1.5 degree IPCC report came out. And, it was abundantly clear what needed to happen. And that was the year that 2030 was the first benchmark year for climate action. And I was empowered, but I was also really deeply uncomfortable with this reality that I guess I had refused to engage with or accept or even think critically about for my entire youth. And so I was just at a loss. And then the pandemic happened when I was 20. And anxiety and mental health became an issue for probably a lot of us in the room today and a lot of young people in general. And then when I was deciding what career to go into, I felt that I had a moral impetus, feeling the way that I did to get into the climate field in general. And so I also work with an organization called National Wildlife Federation and a project in New York City called the Climate Resilience Education Task Force. And as an early 20-something-year-old, was talking about really difficult things with high school students and children, and I felt really ill-equipped, to have these conversations while actually not doing anything to mitigate the complexities of my own emotions. And so I started trying to find ways to talk about climate anxiety and climate emotions with the high school students. And I found that even our really, really quiet students who wouldn't participate suddenly had a lot to say when you gave them the space to talk about it. And so I found that really began to alleviate my emotions, given that I was talking about climate change all day, telling high schoolers, I don't really have the answer. I myself am just a human being and I'm trying to work on it. And so let's just figure this out together. And then I crossed paths with Sarah and started working at the Climate Mental Health Network. And it really helps me. It gives me, like Sarah was saying, the language to talk about the issue with other people. It makes me feel less alone to know that there's other young people and other children younger than me and adults who are older than me, who are in very different areas of work sometimes and have very different upbringings, but we can all kind of rally around the fact that things don't feel normal right now and we should be able to acknowledge it with one another as human beings. So yeah, working in this space is one thing that I do to mitigate my emotions. I go to therapy and I talk about it at therapy, and I live in Miami. And so I was just telling some folks here that sometimes it feels like I'm insane because nobody seems to care in a city where it's not fun or cool or sexy to talk about climate change and the way that it's impacting us. And so, yeah, working is what the thing that I do that really makes me feel like I'm doing something about it, rather than climate action as an individual activity that I do. It's more of a trickle down. I'm talking about this with other people. They might introduce the topic to their parents or their siblings or their families or their teachers, who then might, continue on the chain. I think I also try to find strategies for self-regulation and emotional regulation when things get a little too scary. So yeah, that's all I have to say. And thank you for giving us a platform to talk about this.
Everybody, my name is Natalie. Thank you all for coming. I'm 19 years old. I am a sophomore.
You lost the mic a little bit.
Like this?
There you go,
Yes.
perfect.
I'm 19 years old, and I'll just go through my story of how I got involved. I really started when I was 12, so that's 7th grade, super young. I was always in love with nature and the world, and I was always in the ocean. I was always snorkeling and diving and camping. And then all of a sudden, one of my most favorite places, the coral reef, in Maui, had just totally been destroyed. And that's when I first noticed that something had changed and something was wrong. And so I kept that with me, and then I went to high school. And then it was COVID. And during COVID was when I really started my climate journey. I'm from San Francisco, so during COVID, there was an organization called the Berries Climate Summit that started, and the whole motto of that was for youth by youth. So we were starting an organization where everything was led by high schoolers. No one was older than a high schooler, and
Get close.
don't know. Okay. Okay, this is better. So no one was older than a high schooler, and we were putting on this summit from local organizations to teach each other about what was happening in the Bay Area. So that's where I started, and I grew throughout. I did all that throughout high school, and then after high school, I graduated, and I realized I was severely burnt out. I was working 20 hours a week just on the organization. Also being a student athlete, a high schooler, a normal kid, it was too much. So I was burnt out, and that's when I really realized that mental health was a super big problem within the climate space as well. And then I met Sarah, and I joined the Gen Z Youth Advisory Board because climate mental health is something that, I mean, you guys are all here, so you guys know about it, you know the importance of it, but it's also something that's going to be emerging in so many more youth who are younger than me too, which is just crazy to think about that. So that's my story on how I got here. Some things that I do now that I've been able to name the emotions that I feel is, this sounds really corny, but I go outside. I touch grass, I sit down. Sometimes I'll take my shoes off and sit on a picnic blanket. That helps me just connect back to why I'm doing this all is so that I can have nature and go outside and just be present. I live in a city, so it's kind of hard to find that sometimes. So going outside really gives me peace. Another thing I do that I think helps in any really mental health scenario, but talking to others, talking to my other climate friends helps you not feel alone, because all the emotions that other youth feel and adults about climate mental health, no one's alone. We're all feeling it. And so being able to talk to others, talk to people who I trust and love about it helps so much to know that you're really not the only one feeling this. So that's me. Thank you.
Hi everyone, I'm Allison, and I'd like to first share a bit about what got me into climate. So I think since I was little, I was always very connected to nature and the environment because I grew up in the suburbs with a big backyard. I learned about like recycling and the rainforest in my classes in elementary school. In middle school, I wrote an essay about anthropogenic climate change. And then all this kind of came together when I was in high school, and I was paying attention to the global youth climate protests, especially with Greta Thunberg, and that really kind of inspired me and made me more determined to pursue sustainability as my major in college, because I was realizing how big of an issue climate change was and how impossible to ignore it would be for me. And so I went into college wanting to study this. And I also wanted to study psychology because I took AP psychology in high school and I really enjoyed it. But then I wanted to see where it intersected with climate. And when I first went into college, I saw the intersection being that of individual behavior change. But as I learned more and more about both psychology and sustainability, I realized that there's so many more different kinds of intersections, like climate mental health, but also the ways that nature supports psychological well-being or people's relationship to nature, and just so many other ways in which psychology can be used to improve sustainability. And that's what I've been trying to explore in my studies. So right now I'm working on my senior thesis in sustainability, and I really wanted to focus on psychology of decision making and also youth inclusion, because I started doing research on urban climate resilience planning last year, and I was wondering why I didn't see any youth involvement in these plans for like long-term, like 2050 or beyond, like resilience. And I thought that youth should be a part of that conversation. So in my work, I did a workshop with high school students from the New York City Youth Leadership Council over the summer. And in this workshop, I had these high schoolers plan for the future of New York City while considering resilience, equity, and sustainability in their plans. And I had them split up into groups to either plan for a 2030 or a short-term scenario, or a 2100, a very long-term scenario. And in doing this, I hope to inspire these students to really think about different kinds of climate solutions and be able to see that there are things that we can do to address climate change. And I think that's really been a theme for me this year, because I was also very fortunate to study abroad last semester in Copenhagen and learn a lot more about sustainability from a more global perspective. And I took this really impactful class about sustainable development, in which one of our main class project was to create like a utopia based, like a climate utopia. And doing this made me realize that we have to first imagine a positive future before we can work toward like what we want to see. And if we go to the next slide here, this kind of is what grounds my work in thinking about what the future could look like. So right now we have what is, so that's like New York City right now. And then on the next level is what could be. So this is, you know, climate solutions that are currently being put into place. And then finally we have what should be, which is like the more transformative scenario, and that's more imaginative, outside the box, and really is a challenge for us to think about like what kind of climate future we want. And that has really helped me to see that there is a lot that's like going on in terms of addressing climate change. And I think especially with how much humorism there still is among like youth, there should also be more conversations about climate solutions and thinking about a positive future instead of just an apocalyptic one. So I hope that, yeah, we can work more towards thinking about that.
Thank you so much, Elisa, Natalie, and Allison. So for the next part, we're going to hear from some experts who are working in this field. Climate has had an impact on mental health for a long time, but it's only really been recognized in the last decade or even 5 years to really take a serious look at it. Though there have been people working on it for much longer, they just haven't gotten the recognition until recently. We're going to hear from some of them now. We're going to hear again from Sarah Newman. We're going to Ben Fulgencio-Turner, sorry, is who organized this whole event. is going to also be part of our panel. He is the director of the Climate for Health program at ecoAmerica, where he supports a coalition of almost 50 national health associations committed to climate action. Before joining ecoAmerica, Ben worked for 15 years in local safety net health programming and support. Dr. Eric Lewandowski is also a clinical psychologist and a clinical associate professor in the Department of Child and Adolescent Psychiatry at NYU Grossman School of Medicine. He specializes clinically in mood and anxiety problems in teens and young adults, and also grief. He is an author of a recent landmark global survey of climate anxiety in young people and lead investigator in the forthcoming survey of US youth with a similar focus. And Catherine Catalano. Catherine is the Deputy Director of the Center for Climate, Health, and Equity at American Public Health Association. Catherine is a communicator, strategic planner, and leader with almost a decade of experience in climate policy, advocacy, and education across sectors and audiences, with a particular focus on centering justice, equity, diversity, and inclusion in every aspect of the climate movement. Eric will start us off.
Great. Thank you, everybody. And just cue me at the mic, so I just wanted to say, this is my first time at Climate Week, and I just really wasn't sure what to expect. And also very mindful that I'm sitting here to talk about climate and mental health from the perspective of impact on youth, while I'm sitting next to 3 people from Gen Z. So it's kind of a strange thing to be talking about you in your presence. So really what I'm going to be talking about is over time kind of an effort to capture, reflect, share, and spread what we can understand about these impacts. And then also, and they relate to all of us, I think, in many cases. I think many people of all ages will resonate with these concerns, and then some ideas about how to get our footing, how to keep our footing. And that'll, evolve into other talks. But Ben wanted me to say a couple words about my own sort of climate origin story. And actually, I hear a lot of it in what you shared as well, the difference being our ages at the time that it happened. But we had sort of a long history of climate awareness as a teenager, growing up in Canada, and in particular, attention to the softening of the winters. Canada is a place where it's really just defined by frigid winters, and a love for that. And fast forward, to 2018 and the publication of the 2018 IPCC report 155, and I just went bananas. And I couldn't find any outlet, couldn't find anybody around me who was sharing, who seemed to reflect the concern that I felt, not colleagues, etc. I'd had major orthopedic surgery, and at the time I had a 1- and a 2-year-old, and so things had to wait until a year later, and the 2019 report came out with no news. Everything was the same, basically just worse. And at that point, I had the realization: how is it that I'm now 40, and I've been worried about this since I was 20, and nothing has changed? And it won't be the story anymore. It won't be the case anymore that I'm on the side, worrying and waiting and watching and wondering. I don't know what the answer to this question is, but from now on, I have to figure out how to get involved. This is going to be a central part of my life, and I'm just going to figure it out. And so what I'm talking about today is sort of a partial answer of what I've come up with for someone such as myself, a clinical psychologist with a research background. And it's a partial answer. It's an ongoing answer. So let me talk a little bit about this. So Ben, I know, is going to talk in a moment about direct and indirect impacts, mental health impacts of climate change, but I'm talking here about vicarious and anticipatory impacts. Nothing particular is happening today in New York City, but it's accessible to all of us to worry about climate change. And actually, climate anxiety is kind of a heuristic at this point. It really describes a whole range of human emotion, and grief. We'll come to grief a lot in my remarks here as kind of a fair comparison condition. Grief has kind of a hallmark symptom of longing for somebody who died, but really encompasses a whole host of human emotions: anxiety, fear, anger, joy, even. And so really, I think a more useful term you can hit it back. Actually, I can publish this. Well, so did you hit? Sorry, yeah, climate emotions, right? I think is a better, a more descriptive, more comprehensive term for thinking about this. And really, climate emotions, I think, reflect in many ways the nature of our relationship to the natural world, the closest of it, and also the extent to which we perceive ourselves as under threat from the changes afoot. And if you can think about, certain subgroups where climate anxiety has been documented, you can think about indigenous populations, thinking about the work of Ashley Consolo in Labrador, climate scientists, Susan Clayton's work, and young people in particular who understand that they will live longer into the crisis. You can switch back. So I had the good fortune, my first foray into climate mental health was to be involved in this global survey from 2021, where I just found that I had time and skills to offer, and I was able to contribute to the survey. This made a lot of news about 3 years ago, and I think because it was the first time there'd been an effort to capture the distress that young people are feeling globally. So this is a survey of 10 countries around the world, 4 from the global south, 6 from the global north. And we found that high proportions of young people, this is 16 to 25-year-olds, were expressing worry about the impact of climate change on people on the planet. That's the global sample was 84% were expressing that moderately and above. And 45% were endorsed that this distress was impacting their ability to function on a daily basis. And you can see, with reference to climate emotions, you can see that this is the global sample down on the bottom there, 67% afraid, sad, anxious, angry, and down, if you can read those numbers. I wanted to highlight here the US sample in the survey actually had the lowest proportion that endorsed distress moderately and above. It was 75%, compared to in the Philippines, that number was 94%. And the functional impact, 1/4 in the US. In the Philippines, it was 3/4. You can think about the differences between the countries, and at that time, the perception of what kind of threat there was from climate change. I think that's actually changed considerably in the last 3 years. I should say within the next 3 weeks or so, we should be publishing a follow-up study in the US sample, an expanded follow-up. So that's forthcoming. These are just some other findings from that survey. I'll highlight here one that, these are not surprising, right? They're startling, nevertheless. And actually, we had people write to us after the survey saying, thank you for doing this. The idea was that it was validating to hear this captured and to hear this written about. One point that's not on here is reference to the feelings of betrayal by government having not done enough to address the crisis. That's not on the slide, but that was one of the key findings of that survey. Okay, I'm going quickly now because I know I'm on a clock. Climate emotions are normal. So this sort of, we know this intuitively, but it bears repeating at every opportunity. So go ahead, Ben, if you can drop the next one. So, this little koala here who's in, and I think this slide has made the rounds. Many of you may be familiar with this, but it's so apt that it's hard to resist. But so the climate, the idea here is that this little koala whose forest's home has been razed is being pathologized as having a mental health problem, when really this is the natural reaction, a proportional reaction to a profound threat. And this experience really reflects, again, our attachment to the world. It reflects our dependency on it and our love of the things which are under threat. So it's an adjustment reaction. Go ahead, Ben. And so it's an important and essential thing that this is not something to deny or diminish. It's something to acknowledge and embrace. It's our species alarm system. And here we have, this is not from the New Yorker. It looks like it is. But if this was the response, it's a whole other kind of problem. Relax, it'll be fine. Which is, I think, a lot of people go through life. It's hard to think about these things. It's hard to really contemplate the severity. Go ahead, Ben. Okay, so some ideas about coping. So, okay, you can drop them down actually. So, all right, that's fine. Might as well drop them all. No, it's fine. I didn't anticipate being this far away. Sorry. So hope is something that we all want to feel, obviously. Is this going to turn out okay? And the problem with that is that it depends on the facts, and it's contingent on the facts, and it's contingent on everything changing faster. And so, hope as a passive process is really not that constructive a response. That's like a waiting for the. And Joanna Macy, and I think is the originator of this idea, and then Rebecca Solnit also writes about the idea of active hope. That hope is a verb, hope is active. Rebecca Solnit talks about it as hope is an axe in an emergency. And so it really is about action. Said another way, and this is now the language that I came to this work from my background in psychology, is purpose. So it's like, what will be, this is an all-weather feeling, sense of purpose. So how will we meet this moment? Who will we be in this moment? And the sense of purpose really allows people to endure a lot of negative feelings. So having purpose does not mean we feel good, but it means we understand how we're going to bear it, basically. Community and connection. This is something, again, I think that all of our presence here today speaks to. It's important. And I see Anya in the front row. I told her that her line, from her newsletter, comrades in truth. To find people who share this perspective, who know what you know, who see what you see, and are trying to do the same thing as you're trying to do. And that kind of connection brings validation, it brings support, it brings impact, I would say. If there's going to be impact, you have more in your group. And then connection, I think one of the Gen Z panelists mentioned connection to the natural world actually also has been documented to have a beneficial effect on mental health. And from a grief perspective, or an attachment perspective, I should say, what it really is, to me, it's reconnecting, it's reestablishing this connection with something that we care so much about, that we're dependent on, and that we see as under threat. So just that act has a benefit. And then respite and joy, these go without saying, but we have to take a break, and that's actually in service of the action. And joy, in words of my colleague Britt Ray, there's too much joy in the world, too much opportunity for joy in the world to let it pass, while we're also pursuing these things of such importance. So I'll just leave you with a final thought here. This is my colleagues, Liz Marks and Caroline Hickman, writing in Nature Climate Change last year. What do you love and how is it threatened? Or actually, what do you love in this world? I had to get that out. And how is it threatened by the climate emergency? How does this make you feel? What if you allowed these feelings to be present and valued them? How might this shape your actions? And what is in your power to change in light of this? And I know that Ben is now going to talk about some of those items.
I saw someone trying to take a picture of that slide. I'll go ahead and let them take it because this is a great slide. Don't want to miss the photo ops. Great. Well, good afternoon, everyone. My name is Ben Fulgencio-Turner. As I said earlier, I direct the Climate for Health program at ecoAmerica. So a little bit about ecoAmerica. We're a national nonprofit, nonpartisan organization really focused on driving social solutions and social action and the social movement for climate solutions. And we do that through three major programs. The Climate for Health program is our health-focused program that I direct. Again, aiming at connecting with national associations and organizations like the American Public Health Association has joined me on the panel today, and working with partners like the Climate Mental Health Network, the American Psychological Association, and many others, all around helping to center the health message around climate change, because that is what connects people to these issues are those relevant core values. And we have a similar program around the faith community, again, connecting around people's core local values and impacts to engage them on climate solutions, and then a communities and civic engagement program as well. So really, really excited to be here today talking about this program, talking about this work. We've been partnering with the American Psychological Association for, I think, 10 years now around research on the mental health impacts of climate change, as well as resources and guidance for different audiences. I have our QR code up to our most recent report from 2023. Also have a couple of copies, not enough to hand out to people here, but you can find the same thing online with the QR code. Again, this most recent report was focused explicitly on children and youth because the data was coming out. There was more and more research on the impacts of climate change on youth. So I've been really resisting, as we've been planning this, stacking impacts and doing presentation on impacts. I feel like people get a lot of that at Climate Week and in these discussions about climate change and health. I'm going to have a few here because I want to make sure that we have a general understanding of this beyond those the indirect impacts that Dr. Lewandowski talked about, as well as those even more direct impacts that your brain and your mental health is part of your body, and climate change affects our bodies and thus affects our mental health. So I'm going to move quickly through this. If you are interested in learning more, please check out our report. You can download it at that QR code or flip through a copy here. But before diving in, I do want to just give a little bit of context. We heard this reflected in the remarks from our Gen Z panelists. The climate crisis is not happening in a vacuum, and its impacts on youth mental health is not in a vacuum. There are a lot of other things going on. So we know that the existing stressors around young people, and especially young people who face additional social barriers or social challenges in their day-to-day lives, that climate change is stacking, intersecting, and amplifying those existing stressors. And so people who are already facing those conditions have existing socioeconomic health or mental health challenges, that these climate stressors stack on top of that, and that they are the most vulnerable and face the greatest challenges. And so the graphic here, which I'm sure is very, very hard to read for the folks in the room, really aims to demonstrate that physical health, mental health, and community well-being are all extremely interconnected. And that both the inequities that are currently in our day-to-day life, that people suffer because of poor physical health and community well-being, even before you start to apply the climate pressures, and that the and family and household health play a critical role in the health outcomes for children and young people. So we know that both individual physical and mental health outcomes are shaped not only by biology, but also by a range of stress factors that intensify risk. And so we've adapted this graphic based on for our 2021 report, and then we've added additional layers reflecting those impacts influencing children. So I'm going to go through a few of these right now. So just starting off with the kinds of solutions that we want to focus on as we move forward on climate change. So the most critical step as we think about how to address the mental health impacts of climate change on youth is thinking about those big picture system-wide solutions. I know I am preaching to the choir here, but the most critical step is to dramatically reduce our greenhouse gas emissions. Tackling the root of the problem is tackling the problem. There is no way around this. And in addition, because our past emissions will continue to cause increasing climate impacts, more extreme weather, greater heat, we must also prepare our communities for future difficulties. We need to increase resilience and adaptation, not only as a health response, but as this critical mental health response for vulnerable communities. And that these resources and mitigation and adaptation efforts must center the voices and needs of fence line and frontline communities, the communities that are facing the greatest risks and facing that greatest level of both anxiety and exposure to stressors, need to be brought to the table in a meaningful way to drive those solutions. I assume that everyone spending hours of their day at a Climate Week event focused on this is not going to disagree with me on this. I just wanted to center this. This is not just a nice thing to do or the just thing to do. It is also necessary to meet the challenge. If you are building a response to the crisis, you need to bring the people who are most vulnerable to the planning table and center their needs in the response if it's going to be an effective response. Otherwise, you're planning a poor, ineffective response. So again, just centering that, again, no, I'm preaching to the choir here. So it's not unusual for lots of communities to have climate action plans. And we know that community level climate action plans can do two things at once. So they can also focus that community around decarbonization through energy efficiency, renewable energy, and help to identify and plan for climate related risks. This is something that the American Public Health Association has been working on for years around supporting the CDC and other programs on centering these programs and bringing them to local communities. These plans are most effective for young people's mental health when they include provisions that consider young people, and again, as we've heard from these youth panelists, bring them to the table not just for the planning, but also for participation and engagement. That making sure that people who are most effective and are most anxious and worried about these impacts are invited into the process, have a chance to meaningfully participate in the collective action and solutions, can address that core level, those core stressors that are affecting them. Having some autonomy and control over the situation and the larger problem is a significant way to address the stress and impacts. I'm going to move quickly through this so that we can get to the questions. In addition, I just wanted to emphasize that schools play a huge role in addressing the mental health impacts of climate change. And so we want to make sure that the first thing is that those schools are healthy spaces with good, and one of the number one things is air quality and cooling provisions, that as the climate crisis accelerates, making sure that there's proper filtration of air and that there's cool, safe spaces for children to be in, that children aren't walking through rows and rows of idling diesel buses before starting their day, that these have physical and mental health impacts on children, their ability to focus, their overall well-being. So making sure they have clean air and cooling inside the building and minimize their exposure to toxic particulates in their day-to-day commute and life in the building. Again, it's just a core response that we should all be thinking about as a mental health and children's health issue. And then in addition, we need to make sure that that teachers and staff are able and have the tools that they need to provide support to their students and engage the social support network, and that children and young people are taught and engaged around climate change in a productive and action-oriented way. That simply naming the problem is important, describing the realities and the science, for lack of a better word, is an important thing for schools to teach about climate change, but then also emphasizing that that children can take action on this and are invited into action, and giving them scaffolding to get started doing more on climate change is an important thing that schools can build into it, into their work. So I work a lot with health professionals around climate change, and before that, I spent a lot of time working in safety net healthcare. There's been a long-term crisis in mental health access and access to mental health services, especially for young people, especially for people who are lower income or have limited English proficiency. It's a significant shortage, and I think that this crisis is a call to radically increase our capacity to address mental health, especially among young people. That we know that the stressors are increasing, both that indirect increasing climate anxiety, as well as the impacts of heat and air pollution, disasters, displacement on people's mental health. And so making sure that throughout all of this, that we, from the very beginning, increase our ability to deliver mental health services. Healthcare professionals can also deepen their ability to engage with young people on climate change and its impacts, making sure that they're able to assess young people for potential traumas, and severe anxiety, depression, making sure that's, again, part of regular primary care, community health outreach, other work to have that early detection, as well as having conversations that are productive and offer things for young people to do on this issue, whether it's being part of a collective solution or being out in front of addressing some of the potential health harms, whether that's talk to your parents or school about and getting HEPA filters to clean out your air, and having cooling shelters for people who are unhoused. So really bringing people in and from a health perspective, helping to address those health risks associated with climate change. Parents are, of course, a key part of this. I think that we know that children go to their family, their parents and caretakers, when they are in crisis, often the very first people they go to. And so we want to make sure that the parents and adult caregivers are able to talk with their children, that they have the support they need to talk with people. So a lot of this is just making sure that we're all committing more to our own support and own resources to match the challenge, but then also making sure that children at different ages are getting the kinds of support that they need. Whereas younger children may need guidance to manage their fears and feel hope. Older youth might need just someone to talk to. I was speaking with a pediatrician a while ago who talks about climate risks to health. And one of the parents said, "You're just going to stress my kid out. Don't talk about it." And they're already stressed about climate change. They're already anxious. Please don't bring this up. And her response was, "Oh, your child is stressed about something. Your child is extremely anxious about something. So have you talked to them about this? Have you engaged with them? Are you saying this isn't real? Let's avoid it." Think about yourself when you were an adolescent. How does it feel when someone you trust is hearing you say you're stressed about something and saying, not a big deal, don't worry about it, or avoiding it? And so really making sure parents feel empowered and feel ready to listen in good faith to their children, engage with them in an age-appropriate way, and then support them with ways to get started. So I want to leave time for our other panelists and for Q&A, but I'm just flashing here. We have several different resources highlighted in our children's mental health report. I'd urge people from these different audiences to check it out. Again, just flashing the QR code here, but also happy to chat with anybody afterwards if they like to learn more about this. Thank you.
Thank you. Okay, so we can just go through, sorry. This is a mission statement of the Climate Mental Health Network, and I think it encompasses our strategy. We take a community-based approach. We're all in this together. No one is immune to the mental health impacts of climate. Climate is affecting all of us. And I look at climate as a lens through which we see everything in life. It doesn't matter what you work on, who you are, everyone is impacted by climate. And then you add the additional lens of mental health. It's impossible to be going through climate without going through the mental health impacts as well. And I don't like using the phrase the climate movement, because I think that sounds exclusionary. It sounds like there's a movement of people who are doing this, and then there's the people who aren't doing it. Climate is all of us. There is no movement. We are all addressing climate in some way. And if we're not, I think a lot of the reasons why people aren't, aside from the minority of people who are not believing in science, goes back to mental health. It's being in a sense of despair, helplessness, hopelessness. So this climate emotions wheel is something that the Climate Mental Health Network created. My colleague Anya, who's sitting here, is one of the lead people who created this. We did it with a researcher named Panu Pakala. And so I'm just gonna, I don't know if this is allowed, Ben, but really quickly, I want everyone to turn to someone next to you and just introduce yourself and what is an emotion that you are experiencing on the wheel right now. We're just gonna do this really fast.
Let's do a group of three here. I feel like hearing the young people.
I land on frustration.
Yeah, I'm at three right now.
But I am 26, so I think I'm one of the young people technically. I try to not spend too much time in grief.
If you ever, Nina's like, I think, very good at bringing crowds together. So thank you all for sharing. I think that, can we just go to the next slide? Oh, really quickly, the wheel is available in 30 languages plus an emojis version, and there's a guidebook, and you can download it for free on our website, climatementalhealth.net. Okay, really quickly, I mean, I know we've gone through a lot of slides, but the Lancet Psychiatry just did a report that came out last month and described climate change as one of the quote harmful megatrends affecting young people. And then also there was a report from UNICEF in August that was about the climate impacts to children, and that included a section about the mental health impacts of climate. This is, one thing that, just came out. I saw an article that was in the Denver Post about wildfire smoke and how it's impacting children. And this is a new study that came out showing that it is increasing risks of anxiety and depression in children. And then the second quote, this is all, by the way, if you go to our website, there's a tab called the issue, and there's links to lots of articles and all these statistics. But this is also very alarming research that was about what was happening to women who were pregnant during Hurricane Sandy, the children that were not born yet, and what their outcomes have been after that. So just, higher rates of anxiety, things like that. And next slide. We've already gone over this. I humbly defer to Eric, one of the researchers on this Lancet study. So you all have already seen this. The one thing I'll add is just at the end, Blue Shield of California every year is doing a youth mental health study. So this is statistics from 2023, 68% of US Gen Zers said that climate change is impacting their mental health. It was slightly higher for youth of color than white youth. And this is, I think Anya had written an article about this. This was a survey of 160 countries, and the biggest thing to look at is that 0 were addressing children's mental health in their climate adaptation plans. And so I think, there's a lot of negative statistics here and all this information that we're talking about. And, and a lot of this is responding to what is already an existing crisis. And I think that there is a lot of positive things that are happening, and that having climate emotions, as everyone has said, this is a normal reaction to the climate crisis, and that people having climate emotions is not a bad thing. And there's a lot of research showing how having climate emotions will lead to taking action. And that's an important buffer also for one's climate emotions. And I think that, when we're talking about young people and climate emotions and what's happening, it's also important to think about how do we get ahead of this? How do we think about upstream interventions so that we aren't having as an acute a crisis as what we're going through now? And it starts with younger engagement and more robust integrated programming across sectors. And so really quickly, Climate Mental Health Network, I know we already talked about it. We have an intergenerational strategy. I'm sorry, I talk really fast and I'm always worried about getting through these things. But it's kind of this trifecta that we had youth at the center. We also are engaging with parents and caregivers. My colleague Anya has led incredible research with parents. My colleague Elisa here is leading our really cutting edge work with K-12 educators around the country. It's really amazing what's happening. We do that through research. We have resources, tools, everything on our website is available in English and Spanish. Everything is available for free download, so please visit it. We have a 9-minute documentary film called Gen Z Mental Health Climate Stories. It's been seen by well over 100,000 people worldwide, and it has subtitles in 5 languages. So please go use the film, show it in schools, libraries. We have all of these different programs. And then one of the centers of our work is our Gen Z Advisory Board. And, Natalie is part of. And then the last thing is that the organization is, the people working on it is across all ages. And here's our Gen Z Advisory Board. And please go to our website for resources. There's the wheel, there's the documentary film, we have worksheets, we have resources for parents. How do you talk to your kids about climate emotions, art therapy, all of those good types of things. Thank you all so much.
Hello, everyone. Once again, my name is Catherine Catalano. I lead the Center for Climate Health and Equity at the American Public Health Association. Go ahead and go to the next slide. We'll sit on this one for a minute. This is my lovely team. Almost every single person on that slide is in this room. So if you see any of them afterward, feel free to say hi and ask about some of the great work that they're doing. APHA just sort of overall, we are both a public health advocacy organization and a professional association for public health professionals. We provide resources and trainings and guidance for public health professionals across the country, whether they work in government roles in health departments or in academia or as community health workers. There are a lot of different ways people are public health professionals. So just sort of setting that tone there for what we do. And also to set the tone here, I love how many panelists have shared sort of their climate story and how they got into this work. So I'll briefly just say that I am also from South Florida. I grew up in Broward County, Florida. We had lots of hurricanes. It was just a part of life. There was one school year, I remember, we had so many come through our county that year. We missed so many days of school that the county extended the school year into the cut our summer break short so that we could make up some time. But I didn't really know how that connected to the greater global systems when I was a kid. It was in high school, I had an amazing teacher who had spent years in as an oceanographer in the Ecuadorian Navy, sailing around the world, taking sea surface temperatures. And so not only was his life very exciting and very motivating for me as a 16-year-old, but he was also very, very passionate about climate change. And as soon as I sort of made all these connections to these things I had been experiencing my entire life, and what was causing them and what the future could look like, I just was sort of like, well, of course I'm going to do this, right? Of course I'm going to, as a 16-year-old that hasn't made a career decision yet, now I have. And I think that's how it is for a lot of people that get into this work, right? And who are able to work towards solutions together. It's a good teacher. It's an opportunity to learn about this. And unfortunately, in a lot of the US, climate change is not taught in schools, especially climate and health and those connections. Whether it's, I think, I have a stat here. Teachers in the US report spending an average of less than 2 hours on climate education in an academic year. And that is those teachers that do talk about it, right? There are the vast majority of teachers in K-12 education in the United States that do not. Some of them because of unfriendly policies or school districts or fear of being reprimanded, which is a reality in parts of this country. Some because they just don't feel like they have the knowledge or the resources to teach on climate change. So a bunch of APHA members in our environment section and our maternal and child health section formed a committee and got together to try to talk about this. What's one way that we can help fill that climate and health education gap for young people? Perfect timing then. You knew where I was going. And they created the Climate and Health Youth Education Toolkit. You can see a little short link down at the bottom there, apha.org/climate-ed. This resource was designed for public health professionals to sort of take up the role as climate educators in their community and go give guest lectures at schools or at summer camps or at after school programs or anywhere that students in grades 9 through 12 learn. Although some folks have adapted it and used it in middle schools and in college level as well. The toolkit includes a lesson plan adapted from NIH resources and lots of supplementary materials for outreach, recruitment, continued learning. There's a lot to pick through on there. I definitely recommend perusing that. We've been working to get that out to as many public health professionals as possible, but also more broadly, teachers have been taking it out, health departments. Actually, you can go to the next slide. There's a couple of these are all the partners that we've been working with to help disseminate this resource. Just this year, we became the primary health partner of the Worldwide Climate and Justice Education Week work, and that distributes these resources to teachers. So it's going directly to educators now as well worldwide. Next slide. And it's been used in some unconventional ways too. So I'm just sort of trying to motivate everyone to look into the toolkit and think how you might use it in your work. The EPA has used it in their Southern Science Institutes. The Kentucky Public Health Department is using it to onboard their employees. It's been used in lots of college courses and students have been engaged to go give lectures on climate and health in their communities, which not only does help close that climate and health education gap, but also helps those using the toolkit get that experience, get that connection to their community, build leadership skills. It's a resource I definitely encourage everybody to peruse. And then I also wanted to talk about, Ben mentioned participation in solutions and collective action as a really important, not antidote, nothing's an antidote to this, but as a really important solution for dealing with some of climate change's mental health impacts. And, that's both on the solution side to create that sense of self-efficacy, to create that sense of hope, the ability to change, the way the future looks. But also the collective action part is really important. And Dr. Lewandowski also mentioned community and connection in building up not only our sense of power together, but also to build up social support networks to help build mental and emotional resilience. And we've been talking about that more and more when we discuss the need for a public health approach to mental health writ large. Climate change, climate anxiety, and traumatic climate events are things that happen to entire communities, entire populations, entire generations, right? This is a traumatic thing that is happening to so many people. And it compounds with other collective traumas that we all experience. COVID was a collective trauma. If you're in a community with rising violence or displacement or any sorts of these other things that entire groups of people experience together, it's just really hard to deal with these major traumas in the traditional mental health patient provider model, right? Not everyone can go to a therapist for all of these things, whether it is unavailable to them financially, or because of health insurance reasons, or whether they are ashamed due to social stigma. There's a lot of people that don't seek that kind of treatment. So public health really needs to be taking on this mental health crisis that we find ourselves in. There's also 150 million people in the United States that live in mental health care professional shortage areas. So I say all of that to say we're also very dedicated to working on the kinds of solutions that community groups can implement together. So that's the next slide here. I'll talk a little bit about a forthcoming resource. I don't have a link or a QR code for you yet, but we have been working with the International Transformational Resilience Coalition, that is a mouthful, on these communities of practice for the last several years, bringing together some mental health professionals and community leaders who have been working already in their communities to address collective mental resilience, building collective mental resilience, whether they work on that from a climate angle or from a substance abuse angle or for any number of areas in this mental health, public health connection. And from that, we are creating, oh, no, go ahead and stay on that one, sorry. And from that, we've developed a set of recommendations for community groups who want to incorporate building mental and emotional resilience into the work that a lot of them are already doing, or form new groups. So there's quite a few environmental justice groups that we've talked to who are now training their leaders in trauma-informed approaches, in all sorts of different programmatic ways to incorporate these principles into the work they are already doing. The guide includes, sorry, I'm trying to look past you because I don't have these notes in front of me and it's far away. The guide includes examples from the field and guidance on building social connections, developing tools and programs to support self-regulation, co-regulation, and self-expression, tailoring activities to vulnerable and marginalized populations, incorporating climate action and nature-based solutions into local efforts, so that not only are you building mental and emotional resilience by working together, but you're also helping address the problem and again, increasing that sense of self-efficacy. And building an initiative that's responsive to change. So we are excited to release this soon. Definitely check out our website, sign up for our newsletter so you can be one of the first to know when that becomes available. It's being reviewed by a lot of partners, so I do not have a date for you, but soon. And then I'll just do one quick plug here. As part of that work with the coalition I mentioned with the long name, it's up there, the International Transformational Resilience Coalition, they are launching an initiative to help work with those community leaders who want to get involved in this work and create an even bigger community of practice that they're calling transformational resilience coordinating networks. These are a bunch of partners involved in that work. If you scan that QR code, you'll be taken to the registration page for our launch webinar, which is next week. So if you or someone you know works in an organization or is doing community-based work that is interested in learning more on how to become a transformational resilience coordinating network or become part of one and incorporate these types of principles into your existing work, definitely sign up and join us for that launch. Thanks.
All right, thank you so much to our panelists. Now we have some questions that we're going to have people decide who wants to answer what. So how do the mental health impacts of climate change intersect with existing disparities and social determinants of health? And how are they different across populations of young people?
Sure, so I'll jump in. So I covered a little bit of this in my talk, but because we know that the folks that are at greatest risk from climate change are already facing significant social barriers to good health, that the social drivers of health are closely linked to the likelihood, your vulnerability to climate disasters, both your exposure, sorry, that was the word I was looking for, exposure to climate disasters are much higher for people who are already facing these barriers. So lower income people, people of color, live in areas where they're more at threat to things ranging from severe weather and disasters, from extreme heat, from poor air quality, and have less access to the kinds of things that help people to bounce back from those, whether that is access to nature and green space, to additional social support, and to consistent healthcare and mental health services. So even though climate change is happening to all of us, it has arrived and is coming and is affecting all of us already. The communities that are on that front line are already facing significant impacts to their health from those social inequities, are also facing, have greater exposure to and greater vulnerability to the impacts. Do you want to?
Yeah, sure. There's two mics. I was like, oh, rabbit. I will also add everything Ben said. There are definitely communities that are experiencing this crisis much worse than others, and as a result, will have greater mental health impacts. But also, I alluded to this earlier, but these toxic stresses, these population-wide traumas will compound, right? You'll feel them all together. Dealing with one lessens your capacity to deal with all of the others. They add to this growing sense of overwhelm. So if you are in a community that is not only dealing with greater impacts from climate change, but is also dealing with all other sorts of disinvestments, and is, doesn't have the resources that you need to thrive. All of these things sort of come together to increase that overall sense of powerlessness and dread, and not even want to think about something like this. So I just wanted to add on to that.
I just want to add one thought about the vicarious and anticipatory effects. And so I didn't mention it in my talk, but there's some evidence, emerging evidence, needs to be further reinforced about connections between that, what I described as a normative, natural experience, and in fact, identifiable mental health problems, for example, major depressive disorder, generalized anxiety disorder, so in lower proportions. One thing about the spread, a lot of it seems that some of the vicarious experience has to do, in the context of actually disasters, severe weather events, et cetera, changing environmental changes, has to do with attribution. So like to what does one attribute these changes, and that relates to the impact that it has. And it strikes me that that's a really important reason for climate education. If these things are all happening and we're sort of not registering that this is something to worry about, that's a problem. And so the educational piece there is really important. Yeah, it's just a really critical element in my view.
Anyone else?
Oh, sorry, I forgot something to add on to mine, so I didn't want to forget the flip side, so while all of these things compound to make life harder, I will also say that combating one and building resilience through one can help make the other things easier to tackle as well. Again, that's why a lot of these local initiatives are dealing with the mental health impacts of climate, among a host of other things, and that's why some of the communities, environmental justice communities across the country, majority Black communities in Cancer Alley and all of these places that are constantly inundated with these kinds of challenges are also some of the most resilient, with the best social support networks that are most well situated to address and solve this crisis. So I definitely didn't want to leave out the flip side of that coin.
Thank you. Okay. So these topics are incredibly daunting. The entire issue of climate change can be overwhelming to the point of paralysis. What do you recommend for people to begin engaging with these topics in a healthy way?
Yeah, climate education is really important so that people can begin engaging with these topics in a classroom setting, because then that opens up a world of opportunity for you to actually be able to ruminate about the topic in a way that's, one, off of your phone, and two, with other people your own age and facilitated by a teacher. So I would just say that separate from an adult who wants to engage with these topics for the first time, climate education is my world at this point. And so I really feel strongly that if you are an educator, we were talking about barriers to education. You just have to take the bold step of talking about this in the classroom, because children want to hear it and they feel like adults in their life aren't being honest with them. And I think that that is another thing that you can do, is just being honest with other people about this topic. There's a lot of, I experience with my friends, just this really uncomfortable, like, this world is doomed. And it's just kind of like an offhanded comment that people will make. Oh, everything's going to, whatever expletive you want to put there, or in like a church, I don't want to say. But yeah, people will just say that, and that's just a really abnormal reaction. It's understandable because we're not really given the space to attune, but maybe just don't accept that as a reality if somebody says it. It's maybe just give them some kind of compassion, like, yeah, I know things are really hard. I'm also struggling with it. And just rather than, yeah, I know, man, right? We don't need to know, like, we don't need to normalize that. Because when we're also talking about the social determinants of health, like, I don't know, is anybody in here like considering how they're going to pay rent, or living in a city where the housing costs are just absolutely mind-bogglingly high? All of this has to do with it. So just kind of being a good ally to a person is the best way that you can ease your own anxiety, and also just kind of extend a helping hand to somebody who's experiencing it as well.
So if this was, thank you, sorry, this was about how to go from like feeling stuck to somehow finding yourself engaged. The thing that I would suggest, and follow my own advice, was just who writes emails like this, and it's like, I don't know if I'm going to send this one to this person. And I would just say, like, the story of my sort of embarking into this work is just sending that email, having the courage to like just grit your teeth and send it. And I've been astonished at who has written back to me, and so, I've never, this is one of the things I love about working in these circles, is that everybody knows that everybody's on the same team and everybody wants to help everybody else. And everybody seems to respond to everybody. If they don't respond, it's because they're busy doing something else that you're happy that they're doing. So, so that would just be my advice. Figure out who it is you want to, what is it you might want to share with somebody, and then share it with whoever that person you think might be receptive.
Oh, sorry.
Go ahead.
Great. So I'll just add to that. Definitely co-sign all of those points. Also, I think that one of the things that we found a lot when talking about climate change, focusing on actions, focusing on local, make it as local as you possibly can. I think that there's a narrative around climate change that this is global. It's about parts per million of CO2 in 2100 and glaciers and polar bears. And all of those things are not untrue. Those are true, but it's also about your community, the air that you're breathing, the responses to changing conditions. And so talk about those responses. Those are real actions. Those are happening whether or not the big picture gets solved or not. Your local picture is happening, and you can take action around that and make a difference. And just getting people engaged in that kind of productive focus can break you out of it's all going to well, wherever, yes. So yeah, so I think that's the only thing I would add to that.
Can I add one?
Yeah, absolutely.
Oh, there's someone has a light down here.
Sorry.
Oh. Sorry. Something that I've always said to other youth and mainly high school and college students is find what you love first, because this movement, well, not movement, I guess, but it's so intersectional. I've always said find what you love and then apply it to climate. If you like photography, that's great. If you like poetry, like literally think of anything that you like, and it's applicable to this. So that's where I always say to start, because it is like super daunting. They're always like, Natalie, you're an activist. I'm like, you're an activist too, though. Like, I didn't give myself this title. I just found what I liked to do. And I liked to talk to other youth, and that's what I did. So you find what you like to do. If you like engineering, like do that and just apply that to this area.
I just wanted to add on to like local perspective, because I think in the past I've seen like so much advice about like individual actions to take on climate change, and like things that are like really small, like turning off the lights or like whatever. But I think it's so important to have that like local perspective and to do climate work in community. And I also wanted to like mention this earlier, I forgot for what exactly, but there's this like essay that I would recommend reading called Under the Weather by Ash Sanders. It's about climate emotions, and I think it helped me feel like really seen, and it's part of the anthology All You Can Save, which is an anthology of climate solutions. So I think also like engaging and learning about climate solutions is really helpful for kind of like thinking beyond like climate like doomerism.
If I can just add, there's a couple things. One, if you're first engaging with this topic and you're starting to feel overwhelmed, or you know someone who's starting to engage with this topic and they come to you because they're like, how do you do this? Tell them that it's okay to set limits. Maybe have like a half an hour a day where you engage with this. And if you find that you can tolerate more over time, then do that. If you're learning something that's making you like bereft, or you find yourself really grieving for something afterward, it's okay to step back and engage with some joy. Also, when it comes to possibly living through the apocalypse, I mean, what time can you have a bigger impact? So that's my sort of like turning things on its head way of looking at things, and maybe it'll work for someone else. Right. Next question, unless anyone else has something to add? Okay. What kinds of policy, for the policy wonks here, can help protect and support youth mental health in the face of climate change?
I wasn't sure I was gonna go first. I think, so there are lots of different kinds of programs, right, that can be implemented and created by policy. But I think the strongest kind of policy on this is the kind that mobilizes funding, like real actual resources to communities so that they can design their solutions, not super prescriptive programs. We love a government program that does these good things, right? But much more powerful is policy change that mobilizes funding towards community created solutions and locally specifically responsive solutions. I'll make a quick plug that there is currently a bill in Congress that I encourage everyone to go look up called the Community Mental Wellness and Resilience Act. It is not specifically focused on youth mental health. It is meant to mobilize community-led intergenerational solutions that include youth. But it very simply creates a grant program at the CDC to fund the types of preventative, collective, local solutions I was talking about earlier. So definitely encourage everyone to look up the Community Mental Wellness and Resilience Act. I'll say it again. And I can let someone else speak. Oh, it has bipartisan co-sponsorship in both chambers. So that's a great start. I know everybody raises their eyebrows and say that. So it's a great start. We just need more public support behind it to actually get it moving and get it heard in committee and whatnot. So encourage everyone to look into and support that. And I'll let someone else talk.
Yeah, I'll just add to that because I saw come through the chat, a question about the upcoming elections and what potential changes in administration or elections could have an impact on this picture and on our ability to make policy solutions. So the bill that Catherine brought up is a great example in that it has bipartisan support, is a real serious climate solution that empowers local communities to deal with the crisis. It does not use the word climate once. It talks about the environment, about the impacts. And I found this in a lot of my work, that when you connect with people on clean air, clean water, on their children's health and well-being, around security, that these are all things where we can still be constructive and productive together sometimes. That we're still able to get some bipartisan support on some of these kinds of programs. And so that is not a perfect answer on kind of how do we get through potential changes in administration together, or administration that is hostile towards climate action. But it is a realization that there are things that we can do during that time, and that people living in states where there is hostility towards climate solutions are still in that fight to push for both a change in the mores and an acceptance of climate solutions as policy, as well as taking victories when you can by framing things around clean air, clean water, children's health, and similar areas that are not necessarily as polarized. So I just wanted to add that little bit of context to it.
I think we don't work on a policy level the way ecoAmerica and APHA does, but I just think that it's important to think about hyper-local engagement and policies that, the federal government is a very slow-moving machine, and there's opportunities to start addressing youth mental health in your school systems, for example. In K through 12, school boards, all of this. We are doing work in the K through 12 sector, and there's, these are not going to be necessarily legislative policies, but how are schools addressing the mental health impacts of climate change amongst the students, for example. There's policies in healthcare systems, all of these like very hyper local ways that people can start to engage in these things and start to really push lawmakers and bureaucrats to create systems changes so that we have the infrastructure, we have the funding at city, county, and state levels, and then yes, federal level as well, but to really think about this in your local community, how you can be a change agent to really push for those policy changes and funding and to address this.
In my other capacity, with National Wildlife Federation and with the Climate and Resilience Education Task Force, we wrote a bill that, if passed, would require students to learn about climate change in school in all New York public schools. And one thing that was different about our bill versus a slew of other states who've introduced bills, some of them have passed, some of them have not. And other states did it by executive order and amendments to their state constitution in many different ways. Ours talks about youth mental health, and it's stipulated in the bill, if it were passed, that you would have schools would need to address climate mental health as well in the classroom setting. And I talk a lot about responsible climate education because it's not responsible to just drop a bomb on a child's brain at a very young age that could potentially really disrupt their nervous system and have really adverse effects and could actually put them in this paralyzed inaction category of people. So that's all to say that when there is climate education legislation that is very well-meaning and well-intended, it does need to include some kind of safeguard for youth mental health. And I'm talking about state level legislation. Sarah's talking about smaller scale, which actually could potentially be more effective because even at the state level, there's huge pushback, not necessarily because of the content of learning about climate change or talking about it in school or youth mental health, etc. It's because of bureaucracy within the education system that makes it really complicated for there to be top-down mandates. That's the case in New York, and it's also the case in other states across the country. So yeah, I'd say include safeguarding for youth mental health. And also what Sarah was saying is try to leverage local school districts and school boards as well.
Thank you so much. All right. What role or responsibility do you see the media having in climate conversations and their impact on youth mental health? This one feels personal.
I could start. I actually, before I started this organization, I worked in the film impact space for many years. So I think that I so strongly believe in the power of media and culture and art to be a force for destigmatizing this issue and making climate anxiety everyday conversation. That the leverage, the power that they have is incredible. At the same time, there's a real challenge with how climate storytelling is affecting people's mental health. And that's coming from nonprofit organizations that work in climate, that's film, that's media, and a lot of this is like clickbait, alarmist, that's really disrupting people's nervous systems. And, you know, sometimes people say to me, well, why aren't people acting? You know, we're giving them all the information, we're banging them over the head, we're giving them apocalyptic storytelling. I'm like, that's why. Because you're giving them those stories and people are in a state of stress, panic, and their nervous systems are overwhelmed. And it really needs to be that we need to have climate storytelling that is telling the reality, but it's also giving solutions, and it's not creating such strain on people's nervous systems that it's not putting people in a panic. The earth is not going to end. We're not going to all die right now. And that is often what it is. Like, click on this email or leave us, you know, $25 because we need to pass this legislation, or we need to do XYZ, or whatever the story is at the end of a movie. And it's really toxic and it's really problematic and it's leading to burnout. It leads to people being in a sense of despair, not having agency, not being able to feel like they have a role in the climate crisis. And so I think that there's a real opportunity to talk about, let's get rid of the hero model. Let's talk about a collective model for responding to the climate crisis. Let's talk about positive things that are happening. There's so much good that is happening in the world in response to the climate crisis. I just heard John Kerry speak this morning and I walked away feeling like we can do it. There's so much good happening and we're not hearing those stories because it's not clickbait. So I think there's just a tremendous need to really think about our mental well-being, our collective well-being, and that starts with the stories that we're telling.
I'll echo and add to Sarah's points that, and I think it's something that's not just for media, and certainly not just the media sitting right next to me, but for all of us. I joked that I was trying really hard to avoid adding to the impact section of talking about climate change and health, that there's a necessity to help people make the connection between things that they care about, their health, their family, their children's health, their local community, and the threats of climate change. But talking about just that and connecting it to the global crisis without giving any other pathway leaves people in a natural space of despair. If it is something that is affecting me, is coming for me, can affect me, and is a global problem that I can't touch, that, what are you going to do with that? So I think that, again, giving people those stories that have a pathway, that have an example for how people are taking action, how you can join in on this action. So I kind of want to give this as a charge to everyone else in your advocacy and engagement around climate, to make sure that you aren't just leading people to that dead end, that you are leading people to a place where there's a pathway for them to do something. They see an example they can replicate. They see a story that they want to be a part of, because that's how we get out of it, is by people seeing themselves in the solutions and seeing a way for them to act.
A different answer to the question. I would love to see more climate, mental health, or just climate books for children, picture books for, I don't know, before 5th grade. And books that include every core identifier, because, well, it affects everyone in the world. So I would love to see that. And I know there's more and more coming out, but if we have these books in children's libraries, then they'll be able to see these stories of people like them doing all this great work, which is so important in any area. So I would love to see that.
Hi, so I'm just gonna chime in, because we have a lovely Eco Bookworms Book Club program that does, focus on exactly that. Definitely, I didn't think I had time to talk about all of this stuff, so it wasn't on the slide, but, at our APHA website, under the Center for Climate Health and Equity, you can find Eco Bookworms. We promote a different children's book, every month on social media, as well, with some discussion questions and ideas for projects, for teachers and parents and caregivers. And we have started in the last couple of years sending books to educators who request them. I think we've sent over 300, something like 330 books to classrooms across the US. And we're hoping to keep that program going for as long as we possibly can. And I think, Michelle, is there an archive where you can look back at past books too? Great. I thought so, but wanted to confirm. So yeah, definitely check that out. There are lots of recommendations. No one book does everything, but as a sort of collective little library of recommendations, there are some really powerful children's books that authors out there are doing on these topics of climate and health and equity and belonging and connections to the earth. And those are sort of the books that we focus on for the book club.
And so our Instagram is at American Public Health, which is the easiest way to find us too.
Yes, yeah, Instagram is a very easy way to find them. They're all the sort of same. You can just scroll back through the last few months. We promote them on the 3rd day of every month, no, something like that. First week.
Yeah.
Of every month, we promote a different book. Yeah.
That Instagram was at American Public Health because that wasn't set into a microphone, so.
Thank you.
Okay.
I just want to go back really quickly to like the film, TV, like in entertainment industry, because there's a lot of great work being done right now with like sustainability in that industry. So there is like Hollywood Climate Summit, there is a climate film festival in New York this past weekend. So there's like a lot more stories, climate stories being told. And I think that if people see more of these like stories represented on screen and just like in culture, then they will have like a greater awareness of it, and that's like where like media has a very big role to play. And I also think that going off the like types of stories that we're seeing, and because there's been so many like disaster movies in the past, there are also more and more stories that are more like solutions oriented. And there's this organization, or like a media organization called GRIS, you might have heard of it. They have like a climate fiction contest every year, so they post like climate fiction stories that include a lot of like climate solutions in them, and they also are very like representative of different groups of people from like different backgrounds, which just highlights the diversity of climate solutions.
If I can add just one thing, I think that there's a lot of great solution stories, and there's also a lot of very alarmist stories. What there's a lack of right now is stories that acknowledge we're gonna take a hit. Humanity is not going to be in as good of a place in 10 years, let alone 100 years, as it is right now. But that doesn't mean all hope is lost. In fact, it sort of calls for courageous hope, recognizing that you're not going to have a 100% win, but you still need to fight. You still need to try, because you can have at least a partial win. And I feel like we're starting to get those stories, but we need more of them desperately. Okay. What kind of work in this area do you think is most promising and you'd like to see expanded? Climate and mental health being this area.
I'll keep it short and just say, those kinds of community-led initiatives that I talked a little bit about earlier. The kinds of, the folks coming together to learn from one another and build out these social support, networks in their localities, before, after, during climate events, just in general, is some of the most inspiring to me. Community health services in New Orleans is an example of a group that engages residents in tree planting, in stormwater management projects, and does it in a sort of collective, trauma-informed way, and creates almost just an action/support group of work and efforts. And there are lots of other great organizations doing that kind of work that inspire me all the time.
I was gonna say basically what everyone has said, but just being able to introduce what climate emotions are to young people. I mean, I just learned what climate emotions were like 2 years ago, and I'm 19, so I learned when I was 17. But if I had learned about what climate emotions were when I was 12, when I was experiencing these emotions, but I didn't name them, I didn't know what I was feeling, that would have helped a lot, because I could have been like, this is what I'm feeling, it's called eco-anxiety, etc. So just being able to have access to learning about this in school.
I think also supporting older youth, talking to younger youth, and information exchange. We had a group of high school students who went to go talk to elementary school students and introduce the topic of climate change to them, because it makes it feel closer in age. And also you can imagine where a high schooler is on their path of life, because if you're an elementary school student, you might be thinking of, grade 12 is something still in your brain, if you're naming the grades, and then after school ends is adulthood in general, which of course it's more complicated than that. But getting people who are still students to talk to even younger students makes it feel friendly and accessible, and still like a trusted way. And so if there's a way to expand that work, and for more organizations to trust young people to handle that kind of sensitive information with young students as well.
I'll just add really quickly that just the fact that we are all here and having these conversations, whereas just a couple of years ago when I would say I have climate anxiety, and people sometimes say, well, what is that? Or, oh, my kid has that. And I think just the changing nature of this, that this is an emerging field, that this wasn't a quote unquote field before. And I can just share really quickly the Climate Mental Health Network. We're doing a really exciting pilot intervention with teachers nationwide right now. There's nothing else to share aside from Lisa's leading the work. But it's really exciting because it's, what Catherine has been talking about, taking a public health, community-based approach, that not going through our mental health care system. And so when we release this next year, it's just going to be really exciting to see how we're able to scale this into schools around the country.
And we're also doing parents pilot next year. And so I just find it really exciting to see that, taking all of this research that Eric and other people are doing and turning this into programs that are community-based, reaching people where they're directly at, and that those people are leading the work.
Oh, yeah, no, go for it.
Thank you. I just wanted to quickly build on, Sarah, just mentioned, this is an emerging field, and Nina, in your opening remarks, mentioned that people have been doing this work for quite some time. People are starting to talk about it more now. But when we talk about all of this exciting work that we'd like to see expanded, that's one thing that still needs to catch up, are the resources to expand this work. I think philanthropy needs to catch up with this emerging issue. There's still a lot of research that needs to be done, but we know a lot already, and we know the kinds of solutions that people are using, and we know the impacts they're having. Even as we try to do our work, there are foundations, Michelle's nodding vigorously, there are foundations that focus on education. There are foundations that focus on environment and climate, and there are foundations that focus on mental health, and it's really hard to find resources at this nexus from all sorts of different sources. So I thought I'd also include that that expansion is one of the hardest things right now. And since we're at Climate Week, some of y'all might know people with money. So figured I'd put that plug in there.
And I just want to highlight that all of the, just about all the solutions we've talked about kind of reflect some of the kind of an insight that I've had doing this work, which is that, in my head, you think that you convince somebody of something and that changes their behaviors. That if you convince someone that climate change is real and a problem, they can fix it, then they're going to start taking action on climate change. And, the frustrating thing is that sometimes it's the exact reverse, that attitude change follows behavior change. So getting people to start taking action on this and inviting them in and connecting it with different ways to get started, having your peers, having older peers in your school, or talking to your younger peers about things that are getting them anxious about it, makes you more likely to take more and more actions, changes your behaviors and your entire standpoint on it. So really, I would encourage people to think about that kind of framing, that what we need to do is give people ways to take action. I forget whether it was Natalie or Allison that mentioned it, that the little actions that can feel so little in a big system still matter. That this is one of the ways that it matters. Doing something as small as doing small acts of conservation in your home is the kind of action that changes your attitude and that makes you more likely to drive larger and larger change. So just kind of bringing out that even though those small things really are worth doing, investing in, and expanding upon.
Thank you. I also wanted to add one thing that I've had the opportunity to talk to a lot of youth in the mental health and climate space. And one thing that comes up over and over again is that they wish they didn't have to be at the forefront of this, not to use the word movement, but I don't have a better word. And a lot of these the ones about youth and the youth activists get highlighted because they're these shiny, bright stories where look at all this hope, and it's not showing the years and years of work that has gotten us to this point. I feel like acknowledging that, building the work that's building upon, all of the activists that came before, all of the scientists who've been ringing alarm bells for over 50 years. That's a big thing as well. And it's also a way to let young people know that they aren't alone. It's just that older adult stories aren't quite as shiny.
Are we taking questions from the audience?
Yeah.
Sorry. Great. I think we're open for.
Careful with the mic, so it's okay,
Yeah.
yes.
We have another mic there.
Yeah.
Miriam, do you mind running the mic? Thank you.
And audience questions? Anyone have questions?
So much for
Brilliant.
today. I'll just speak loud. Thank you so much about the policy initiatives, because I'm a climate educator at heart, but I've fallen into the advocacy policy space. Is there, not to put you on the spot with specifics, but is there a specific policy win that has happened that has benefited childhood mental health in the realm of climate change that you could point to as an example to then replicate elsewhere?
Do you want to repeat it?
Yeah, it didn't pass. Well, others have and others, well, yeah, here,
Repeat the question if you can, Catherine, just in case.
Sure, we're talking about policy wins in this area. And I think I don't know how much policy has been introduced on state or local levels. Other people in the room might have good answers to this regarding specifically climate and mental health, but climate education as a part of that, right, is addressing youth mental health. There are a couple of states that do mandate climate education in the United States. New Jersey, Connecticut, and now California recently have all passed legislation mandating climate education in the US. That is something that I think is definitely replicable and should be taken up in other states. And is a starting point, you know, as a lot of us have said, education was sort of our entrance into action, which has helped deal with our own climate anxiety and many others. So yeah.
Okay. I'm just going to add one very parochial one from Prince George's County, Maryland. It's my home county that recently passed with huge student participation of climate action plan into the school that meets all of the UN standards for achieving sustainability within the school and engaged youth into the program. This is, you know, a predominantly African-American school district, with a large Latino population, and really brought in those students' voices, their concerns, and implementing a real climate action plan that meets those UN emissions reduction goals, as well as providing additional support through the school system. Any other questions in the room? Yeah.
More of a comment. More of a comment. Basically, the project I've been working on is climate storytelling. I'm an impact producer, creative producer, and I work in emerging formats. So what everybody said today has just like really solidified that I'm on the right track. So I just wanted to thank you all because we're really writing story to amplify hope, not doom and gloom. And then we're building a gaming app. It's Pokemon Go meets geocaching for the environment. And it's all about learning and small tasks that people can do so that they're not feeling hopeless and helpless in the world, that they actually have a tool and learning that empowers them to go out into the world and not sit on the couch and doom scroll, but know that they can actually take action and make a difference.
Thank you.
Okay, we have a question from the chat from Eliana Stromberg. From a research perspective, how do you navigate dealing with such complex and sensitive emotions among young people? Have you encountered barriers associated with the ethics of this sort of research? And what concerns do the panelists have in terms of how a change in political leadership in the upcoming, going back to, have you encountered barriers associated with the ethics of this sort of research?
So on the first one, so that this maybe a little, I don't have a thorough full answer for this person because the research that I've been involved in has actually been quite removed. In fact, it's all sort of survey research, so we're not actually interfacing with young people in it. And so we've gone through ethical approval for all that and followed all those things. But it's certainly something we advise and mention in our research. It's sort of in there on the boilerplate that, you know, should this be a evoke negative emotions, we provide opportunities, you know, information about supports that they can go and get. So I'm afraid it's an unsatisfying answer to the person, but that's the best that I can give based on my interface with the research. I should also say though, in some of the more direct interactions I've had in preparation for research, you know, focus groups, etc. And it's a small group, you know, that I've interacted with in this way. I've not actually experienced or caught wind that discussion was distressing any more than you would expect it to be distressing. So in fact, I've found my experience and what I've gathered from the people participating in those groups is that it's been helpful to share. Which is not to say there's not other there are other outcomes as well, but that is the thing that I've walked away from those encounters that I have had. But anybody else may have.
With our work with Gen Zers, we always compensate them. So our Gen Z advisors are compensated. Anytime they do a public event, they are compensated. We are doing focus groups with Gen Zers right now, they are compensated. If we hire Gen Zers to consult, they are compensated. So there is no free time with any of them, and it's really important.
I just wanted to say, I was supposed to do research with UC Riverside on climate emotions in young people in California. And one hiccup that we ran into was having or not able to have people under 18. And that was super important to us because we wanted the high schoolers, people who were like in the pivotal transition of finding what climate journey they're in. So that was the hiccup that we ran into.
I have a question. So thank you so much. You guys hear me?
Yeah.
Just use the mic because we have a Zoom.
Oh, okay. You guys hear me?
Yeah.
Thank you so much for the panel. It was so informative. And I'm a mental health counselor. So my question is, as a therapist and as a mental health counselor in the field, how do you see our role changing as the awareness grows for climate change?
So as a mental health professional,
Yes.
so it's so I think I was talking before the talk about a couple different trajectories. We're on one trajectory, which is that the facts of the matter have to change, right? And that's one. And there's another one which is in the near term. That's a slow process, even in the best case, right? So there are needs and emotional difficulties, challenges on the way as well. So as mental health professionals, you sort of look at this and think about, well, where do I fit? And it can be a different answer for every particular person too. There's no one answer for everybody. But the way I think about it is if we're describing these emotions as natural, as adaptive, this is and proportional broadly. The way my clinical thinking went to that was that, well, that means that what I'm not meant to, am I meant to be treating something here? What am I treating? Another natural emotion, which is very distressing, or natural is grief. Are we treating grief? Well, in some situations, yeah, we are, but not in every situation. And nobody would say, well, I don't think that just because you are bereaved and you experience grief, you should be in therapy. If you want support, nobody should try to persuade you also. But if this is the way you think about it, for my own part, I thought, well, my understanding of this points towards advocacy. It doesn't point towards treatment. However, for the clinician sitting next to me, they might say, well, the way I relate to this is to actually lean in towards figuring out how to provide that more immediate emotional support. So there's just some thoughts about different ways that, different orientations to it. And really, I guess the real take home is like, whatever suits you, whatever suits your inclinations as a mental health professional I would say is what should guide you. As far as education about climate aware therapy, et cetera, there are lots of resources. Sarah has plugged into some of those networks. There are a number of other organizations in the country that really can help people get their footing in that area.
Yeah, I would just add to that it's really it's one of those areas where I don't think there's a big difference between the mental health professional space and health professionals more broadly. That kind of what Eric described, people come in with heat stroke right now. People come in with Lyme disease and other conditions. So you're having higher rates of incidence, higher levels of vulnerability, and there's a need for additional education and ability to do counseling around risks and management of conditions. But that goes across the board. And I think one of the other questions that came in the chat was kind of addressing the shortage of mental health professionals in the country. I think that there is this severe shortage, and I think that is as these conditions become, just as if there's a shortage of any other field in the health professional area, there's gonna need to be a real investment into making sure that we have enough mental health professionals to meet where there's a predictably growing demand for those services.
If I can just add one thing, there's the division between the overall existential anxiety, distress, whatever emotion is manifesting around climate change. And then there's going to be a growing need for post-disaster PTSD treatment, helping people who have become refugees because of climate change. And also, you know, the helping people work through the fact that they may need to preemptively migrate through managed retreat so that they aren't fleeing a natural disaster. And those are very emotional processes. And that's probably going to also need mental health counseling. And we also have a shortage of resources there, but it's slightly different from the more existential climate anxiety, just for lack of a better word, because that might be more adaptive.
Yeah. Sorry, Nina, to add also, like, my comments before were about sort of that anticipatory vicarious rather than sort of the direct mental health impacts, for example, the results of, yeah.
Thank you.
Any other questions? Great. Well done.
Thank you everyone for coming, and thank you so much to our panelists.
I'll just add that for those joining online, thank you so much for coming in, and for everyone here in person. We'll be sending out a recording for this later on, and we look forward to connecting with everybody. Please don't be shy about reaching out to our panelists and asking us for more of our resources or more questions. Really happy to connect. Thank you again.